Hello, I'm Christopher Bredesen, the Director of the Ottawa Hospital Blood and Marrow Transplant Program. We have made this video as an introduction to our transplant program. During this video, several members of the BMT team are going to introduce themselves to you, provide an overview of their roles, and tell you a little bit about what you might expect from us if you participate in our program. We also will outline a little bit about what we expect from you should you become a patient in our transplant program. As the transplant program continues to grow, we thought it would be important to provide this particularly for patients who are not from the Ottawa area. Not all the information you will need is in this video, but it is an introduction. We hope that after watching this video, you will feel more comfortable about transitioning your care to our team during this difficult stage of your life. BMT is a complicated, highly specialized area of medicine. It is also strictly regulated both by Health Canada and an international accreditation program. We are proud that our program was the first in Canada to be accredited by the international organization and has been accredited for over the last 15 years. This accreditation reflects a high quality of care and expertise that is available to our patients. I used the word team before when referring to our BMT program. The BMT team consists of many different types of healthcare professionals who work together under the leadership of blood doctors, also called hematologists, who have had additional training in blood and marrow transplantation. What is likely different than the care at your local hospital or clinic is that we work in a group practice. You do not have one doctor and nurse who care for you. You are cared for by a group of doctors and a larger team. Currently, there are about 10 doctors who work together in the transplant program. Don't worry though, we have several meetings each week to discuss how patients are doing and to review your plan. Having a transplant is, as they say, a journey. And unfortunately, like any journey, there may be unexpected bumps in the road or detours. The transplant team is continually considering what is the best course of action for managing your illness. Sometimes plans change frequently and without much warning. For most patients, we try to provide your care, including your transplant treatment, as outpatients in our day hospital. We will discuss this more when we see you, but it is a central part of our program and requires particular commitment from patients, their family, and support network. You also need to have a dedicated caregiver or caregivers to help you during your transplant journey. When in Ottawa, they will need to be with you 24 hours a day, 7 days a week. This obviously takes time to arrange and can be challenging, but it is very important. The team will work with you to sort out these logistical issues well in advance of your transplant. Now that I have your attention, what message would I like you to take away from this video? First, as I mentioned earlier, reassurance that you are coming to a program that is made up of individuals with a high level of expertise who, although not perfect, are dedicated to providing you with world-class care in a compassionate and supportive environment. Second, that you can trust us to always tell you the truth, even when it is a difficult truth. And lastly, that we will care for you as we would want our loved ones to be cared for.
Hi, my name's Linda Hamlin. I'm the advanced practice nurse with the Blood and Marrow Transplant Program. One of my roles is to help to coordinate the many pieces involved in organizing your transplant and care. We will meet you at consult and follow you through the transplant process. Our program performs stem cell collections as well as autologous and allogeneic transplants. Both types of transplants require you to receive high doses of chemotherapy with or without radiation to treat your disease. In an autologous transplant, stem cells will be collected from you prior to your transplant and returned to you to help your body recover from the high-dose treatment. In an allogeneic transplant, you will receive stem cells or bone marrow from a donor who may or may not be a family member. These are complex treatments, and they will require further discussions with the transplant team. We will meet with you and discuss your questions, your concerns, and we will work very hard to ensure that your needs are met.
So Heather and I both attend meetings throughout the week, team meetings where we review each patient who's preparing to go to transplant, and we work together to make sure that everything is done to prepare you for your transplant. We're often in clinic, so we also have pagers, so you're welcome to page us if you have questions or concerns or symptoms that you want to talk to us about.
So my name's Kenzie McCurdy. I am the social worker with the Bone Marrow Transplant Program. And I see every patient that comes in for a bone marrow transplant. I see them at a number of different stages. I can see them before transplant, I can see them once they're admitted for a transplant, or I can see them post-transplant for up to a year. And my role, the things that I help them with are manyfold. The biggest concerns, I would say, pre-transplant, financial. What someone's finances, how are they going to cope financially? Because it's not only finances for them, it's finances for the caregiver. So we look at what funding is there for them, trying to see what I can do to help with costs for lodging, for meals, for transportation, for gas, things like that.
My name is Kate, and I'm the clinical manager here of 5 West, which is the inpatient and the outpatient stem cell transplant unit. Our unit is set up to allow you and your family the opportunity to be at home as much as possible. Now, depending on your clinical status and some of the conversations you've had with your doctor, that may mean you're admitted to our outpatient BMT program, and it might also mean that you're admitted directly into our inpatient ward. On both units, it's an incredibly dedicated team with specialized training that are designed to meet your needs and the needs of your family during your stay. As your care needs change, our care that we provide for you is going to adapt and change as well. The BMT outpatient program is designed to allow you to be away from the hospital as much as possible, as long as you're feeling well, and the other care requirement pieces allow us to support you at home or close to the hospital. Infection control is really important for you and your family during this time. One of our infection control measures that's unique to this unit is we do limit children under the age of 12 from entering the unit. The reason behind this is that, as you know, kids are out, they're in their school environment, and there is additional risk that they can pick up and carry germs. We recognize that being away from your family is never easy, and we do have additional things in place to allow you to be with your family off the unit. On a day-to-day basis, you'll get to meet doctors and nurses and pharmacists, and as needed, you'll have the opportunity to meet with dietitians, physiotherapists, and occupational therapists as well. We're all here to make sure that we're addressing your needs at each point in your transplant, and at every point of each day, we're assessing your care and making sure that all of our interventions are the right ones for you.